It's a new year and many people have made resolutions to be healthier, so we're here for a new segment at the Ferezy Clinic about complementary and alternative medicine practices. We're here with Dr. Ferezy, and thank you so much for joining us today.
Sure.
So Dr. Ferezy, you're a former assistant professor of neurology at the Northwestern College of Chiropractic, and you've also authored a textbook on the subject. So I was hoping that you could tell us a little bit about complementary and alternative medicine.
Sure. Let's step in the conference room.
So what exactly is chiropractic neurology?
Well, like medicine, chiropractic has specialties. And one of those specialties is neurology, which is an interest in the nervous system. So if a chiropractor wants to become a board-certified chiropractic neurologist, they take a series of courses, and it's my job to work with the chiropractic colleges to set up and teach in those courses. Actually, my focus today, though, is on my frustration with the skyrocketing costs and problems in our healthcare in this country. We know that the political system is trying to deal with that right now, and really the solution is CAM, and nobody is talking about it. What I'm hoping is that with your help, we can get the public educated and maybe even a bit outraged about good, well-researched, documented information about healthcare that they're simply not getting.
And for those of us that don't know, what exactly is CAM?
CAM is an acronym that stands for Complementary and Alternative Medicine. And when we use the term complementary, we mean something that would be done along with the treatment that perhaps your family doctor would recommend. Alternative would be as an alternative to the traditional treatment.
So how does CAM save someone money? It seems like adding on another procedure would just add on more money.
And that's a really good point. CAM can save costs because it's infinitely safer than traditional medical treatment. And if you have society living healthier, then it's just less expensive to take care of them. My concern is that a lot of the information that's out there about these procedures is simply not getting to the people who are suffering right now and need this information. I mean, how can you keep yourself healthy if you really don't know how? What's good, what's bad, what should I do, what should I avoid? Many patients are actually taking dangerous medications or eating foods that they're having adverse reactions to, or doing the wrong exercises that are actually hurting their back, for example. The list goes on and on. So even if it's just a catch in your neck or a headache that you walk around with all day, then that's one less day that you have to enjoy your life and be healthy.
So what kind of information are you talking about?
I'm actually talking about valid scientific information that's been documented, researched, and is readily available about treatments that you and your family are just not hearing about.
So I know we all want to stay healthy, but normally when I'm sick, I go to a family doctor, and don't they normally tell you what's best?
Yes, and I should start by saying that some of my best friends are medical doctors and osteopaths. This isn't a show to bash medical treatment. I'm not a conspiracy theorist. Essentially, what I'm trying to say is that drugs and surgery, while they've made strides in technological advancements in treating acute disease, they've pretty much failed in chronic diseases. For example, right now, if you live to 85 years old, you have a 50% chance of having dementia. And we're talking about 1 in 38 children who are born with autism. Parkinson's disease is on the increase, diabetes is on the increase, arthritis. So the chronic diseases are where that approach of drugs and surgery has limited effect. Now, your family doctor is always going to strive to do what's best for you, but you really do have to consider their training. Where are they coming from? And their training is in pharmaceutical or drugs and surgical approach. And there is an old saying, if you're a hammer, everything looks like a nail.
So can you give us an example?
Sure. The National Institute of Health did the largest study ever on acupuncture. It was on acupuncture for osteoarthritis of the knee, and your tax dollars and mine and the audience's paid for that study. The conclusion was that the patients in the acupuncture group had 40% less pain and 40% better function than the groups that they were compared to. So if you have osteoarthritis of the knee and you go to your family doctor, I just don't think they're going to tell you to go get acupuncture. I think instead they were going to tell you that you need some anti-inflammatories, or what we call the NSAIDs. And if it's bad enough, well, then you could just have knee replacement.
But don't drugs work to relieve pain?
Yeah, actually they do. The NSAIDs are very effective in relieving pain of osteoarthritis for the knee, for example. But that's like you're smashing the oil light on your car when the oil light comes on. Eventually you're going to ruin the engine, or in this case, you're going to ruin the knee and need a new one.
So what you're saying is that over-the-counter drugs such as ibuprofen, Advil, and Aleve can actually hurt you?
Yeah, absolutely. In fact, M. Michael Wolfe of the Boston University School of Medicine stated that if they were given their own classification, these anti-inflammatories would be the 15th largest killer of Americans. These are very dangerous drugs, and they can attack the heart, the gastrointestinal system, or the kidneys. One study showed that you had 26 times greater chance of having heart disease if you had a pre-existing heart condition and took these anti-inflammatories. And you can see from the long list of drugs that have just recently been taken off the market that drugs are inherently dangerous. And in fact, I think people know that intuitively. While it's difficult to hear this, medical treatment accounts for the third largest killer of Americans, only behind heart disease and cancer.
Well, Dr. Ferezy, thank you so much for talking to us today. I feel like we all learned a lot of great information about complementary and alternative medicine. And I know that you have a bunch of future segments coming up, so can you give us a little preview of what you're going to talk about?
Sure. First thing I'll do is pick up on acupuncture. We'll talk about what the first visit to an acupuncturist might look like, what is involved in choosing a provider, but we can talk about chiropractic treatment, traction, antioxidant juices, low-level laser therapy, massage, just a host of safe alternative treatments that are out there for your audience.
Well, thanks again for joining us. I look forward to those future segments.
Thank you, Cathy.